Good evening, ladies and gentlemen, and a very warm welcome to the second edition of ET Healthworld Fertility Conclave, the most comprehensive series on assisted reproductive technology, powered by Merck, Nova EV Fertility, and Apollo Fertility. This is Shivangi Anand, your host for the evening. Motherhood can be wonderfully rewarding, but the journey towards that can be frighteningly challenging if one faces the issues of subfertility. However, having a child should be a matter of personal choice, not dictated by financial, legal, or medical constraints. And it is in scenarios such as these that assisted reproductive technology has come to the rescue of millions of childless couples, enabling them to experience parenthood. ET Healthworld Fertility Conclave aims at bringing together all relevant stakeholders from fertility practitioners to Indian medical world's movers and shakers, such as yourselves, on a single platform to address this very topic, fighting infertility. ET Healthworld Fertility Conclave is the initiative by ET Healthworld, which has stemmed from a collaborative effort and is supported by an ecosystem of partners, and I would simply like to take a moment to acknowledge them. Powered by partner, Merck, Nova EV Fertility, and Apollo Fertility. Community partners, Indian Fertility Society, Federation of Obstetric and Gynecological Societies of India. Telecast partner, ET Now. But I would especially like to thank you all in the audience. This forum is intended to be interactive, and brains inside the room assure me that we will be having exciting conversations with serious conclusions. And to help put everything into context, I would like to invite the editor of Healthcare and Life Sciences at ET Prime, Dr. Anuj Gupta, to please approach the dais and address our august gathering.
Being a mother is to know about strengths you never knew. Welcome all delegates and my colleagues. I'm Dr. Anuj. I'm editor Healthcare ET Prime. We have assembled to participate in the second chapter of 5 series discussion by ET Healthworld on IVF, an industry which is now getting attention, a child that is being embraced slowly but gradually. In India, only 1% of childless couples undergo IVF. In an year, only about 1 lakh cycles are administered when the need is so much more. Unfortunately, lack of standardization, absence of regulatory control, financial barriers have created challenges enough to restrict the industry's growth. Investment too in the sector has not really kicked as expected. Till 2012, 37 companies ventured into IVF space and they grew on their own. Between 2013 and 16, around about USD 113 million were invested in the sector, whereas when we compare to other specialties, it was a bit less. What stops us from delivering to the 100% of the perceived demand that we have in the country? What holds us back? During chapter 1, we set the tone and asked the patients about their personal challenges to consider IVF. Today at Hyderabad, we asked the specialists, the gynecologists, about the challenges that they face in their routine practices. Today, we intend to focus on bottlenecks in a patient's journey across an IVF clinic. What can we do to smoothen it up? How can we make IVF more accessible? Are we short on specialists? Are we not keeping pace with technology? Or do we have quality issues? These are some of the questions that we will debate today and try to find answers. We believe the IVF industry has a lot to offer, and there will be a day when no couple would give up having a child without giving it a try. In our attempt to weed out these challenges, we will take this discussion forward with institutional investors in Mumbai, technology providers in Bangalore, and bring up the need of standardization in Chennai. We look forward to your continuous support since the journey has just begun for us. Thank you so much, and have a nice evening today.
Thank you, Dr. Anuj, for setting the tone of the event so beautifully and giving us the glimpse of what the journey of ET Healthworld Fertility Conclave is gonna look like.